I'm Claire and I'm back again with episode 2 with the lovely Julie.
Hi everybody, my name's Julie, I'm a midwife in Dubai. I also own my own company, British Care, and we're here to give the best care to all pregnant women and new mums.
When you are pregnant, what's the first things you should do?
So what you need to do is find a hospital and an obstetrician.
Okay.
And find a hospital with a good midwifery network within the hospital.
Okay.
I work at Gargash Hospital. We collaborate with British Care. I find that hospital really good. They're very patient focused. They're not money driven like some of the private hospitals here.
And where are they located?
Sakim, so
Okay.
they're dead central.
That's really
really,
good.
central.
And how long have you been doing midwifery?
So I've been a midwife for over 18, well, I've been in maternity for over 18 years. I didn't train to be a midwife till I was 44.
Okay.
And I've gone into midwifery for personal reasons.
Okay.
For me, I feel it's my vocation, and I really, really do care about everybody. I also had not the easiest of pregnancy journeys. I've got 5 children.
Whoa.
And it was a bit up and down. I've also had some of my children abroad.
Okay.
So I felt in a foreign country, not being able to speak the language. You're already anxious about having a baby.
Absolutely.
But when you're not in your own environment, it just escalates. And it's just foreign. And it's nice there was a real need here for proper British care so that people feel more comfortable. And at the end of the day, British Care is the gold standard care in obstetrics.
Yeah.
You can't get better care. And the midwives are all really highly trained. And they just know how. They don't only look at the medical side of it, but they look at the whole being, and that's what we try and do. So we support people emotionally. We like you to get to know us antenatally, and we are at your birth. So at least you've built up this relationship. You're not going into hospital and thinking, I wonder who's going to be on shift, I wonder who's going to look after me, because you get to meet the whole British Care team.
So what's the difference between you guys and a doula?
I feel, and there's some lovely doulas here, but I actually feel it's worth having a private midwife because they can tell you exactly what's going on. They can read a CTG, they're qualified to do all that. We study for years. Even if you haven't got a pregnancy that's high risk, if you're at a hospital and they're pushing for a C-section, a midwife will be able to tell you if it's correct. You know, I mean, I'm well known in Dubai, so I can go to most hospitals and I can have a proper conversation with the doctor.
So what if people want your team,
Yeah,
but they don't want the hospital, they want to choose their own hospital?
but it's fine.
You can still do it that
Yeah,
way?
yeah.
Oh, that's
There's
really good.
certain hospitals that we refuse to deliver in.
Okay.
And that's because we just don't agree with how they give the care, and the patient comes first.
Yeah.
And even if they decide not to have us at the delivery or whatever, we still support women postnatally. We do a 30-day service when you've had your baby, because
Okay.
I think that's very frightening when you're in a foreign country.
Yeah,
You've
absolutely.
just had a baby.
Especially if it's your first.
And we also do the health visitor visits.
Okay.
We do milestone visits.
Okay.
Because what we found here is, because a lot of people are quite isolated, they've got a friend group but not a real friend
Yeah.
group. We find that the babies aren't reaching the milestones, which is
Okay.
really detrimental to
So what
women.
age do you do it to the milestone?
I think you should do it up until the 2.
Okay.
Yeah, and the milestones are not about walking, talking, sitting up. They'll all do that, and they'll all
Yeah.
crawl in their own time. You don't need to push that. The milestones are about how they are socially,
Yeah.
cognitive. You know, if they're looking at things, if they're following things.
Yeah.
And if they miss 1 month of milestones, that can set them back. When they go to school, they'll never be able to high achieve. Milestones are really, really important. So we come round for an hour, we bring toys actually, which you keep, and all kinds of freebies that we get from various companies.
Maybe you should come round and do a milestone on
I
Tot
will.
and James.
Yeah,
And
definitely.
if you want to see that, let me know and we'll set that up.
Yeah, definitely, we will do that. We went round to somebody's house not so long ago, and the little boy was under a mat with a frame round, and she said he doesn't concentrate on one thing,
Okay.
and it's a mistake a lot of people make. When we looked at the frame, there was about 25 things dangling from it, and I said to her, "You just
Always
need to
think you
take
wanted.
everything away. We
Yeah.
just need to have one thing dangling." And you know what? Within 24 hours, he grabbed it.
Yeah.
So it's just the little things, and I do feel, because I've had 5 children, I not only know the theory behind everything, and all my children are quite different personalities, and my youngest is adopted,
Okay.
so we've got a real mixture there.
That's really good.
So they've all done things in their own time, but I feel I've not only got the theory, but I've got the practical.
So you're not only like a midwife, you're like a mum.
Yeah,
And these
and
women are really going to build up that mum relationship.
Yeah, definitely.
So
yeah.
what if they bond with you and then they need a C-section? Would you be there with them? Or is that-
100% I'd go into theatre with them. Well, what we do is we pre-arrange it with the hospital. So we put everything in place.
Okay.
So it's not a shock on the day. At the end of the day, your body, your birth, your experience. Remember that. The hospitals are not in charge of you. You are paying for a service. If you went for a meal and somebody said to you, you have to have the salmon,
Yeah.
and you didn't want the salmon, you might walk out of that restaurant and think, well, I'll go somewhere else where I can have another type of meal.
Yeah.
Same with the hospital. They're providing you a service. You are in charge of that service. I think people, when they go to hospital, lose the confidence to say, actually, I don't want to do that.
And what about aftercare? You know, say if somebody's just had a C-section but they don't feel like they're getting the care, so they don't feel like they're being prescribed medicines and they're not getting
Just
it.
ring us and we will come and sort everything out. It's needed as well. I mean, I've been here 4 years. I've delivered babies here. I've been at lots of births here. I've supported lots of families.
Yeah.
I've supported them changing hospital and things like that. You have to be in charge of this, and do not let anybody do something to you that you have not consented to. I mean, I'm not saying there's never a need for a C-section, and honestly, whatever the woman wants, I'm happy with, as long as she's happy. But so to be pushed into something that you don't think is necessary can affect you mentally, because you spend then a lot of the first month of your baby's life thinking, I wish I'd said that, I wish I'd have done this, I feel that I have no power. And when you feel that you've got no power, that can really affect your relationship with your partner and your bonding with your baby.
agree with that.
And bonding with your baby is something you need to do. It's really
Absolutely.
important.
I was pregnant with my third,
Yeah.
which I had in Dubai. I was in Singapore.
I was
and
taking
you were
care of it,
taking
yeah.
care of everything in Dubai, so that when I came here, I had no worries.
Yeah.
That personal touch, you know, that you won't get.
And I know all my patients. I know them a lot.
I believe that.
Yeah, I mean, I really do. And I'm a bit of a workaholic. People say to me, you're going to slow down, but I never want to retire. I just think to myself, I don't know what I'd do if I didn't work. Even though I've got a very busy social life, got very busy with the children. I mean, they're all grown up now, but they are here. But I just love it. I just love my job. And I just love it when a family's together.
Yeah.
And, I'm now going on journeys with families that the second one's coming along.
Absolutely.
So that's really, really lovely.
Yeah.
So I really love my job, and I just think that it's needed. The team I've got in British Care are like me. They're exactly the same. I've handpicked them. I've worked with them all, so they're not strangers to me. And we definitely think the same, we do the same.
Are these from similar background? Or?
They're all trained in the UK, and they all follow our British standards. And they're just such a lovely team, absolutely lovely.
I mean, the British Care always have the best events. They're always packed out.
It's a nice problem to have. We're having our next event on the 28th of July, but we're having to look at bigger venues, and they're completely free, by the way. It's a free breakfast. It's called Julie's Breakfast, and we do massive giveaways. We give away breast pumps and all sorts. We've got a real...
Last time we had high chairs, strollers.
Strollers, yeah. Car seat.
Car seat. They were really good prizes, and that was with Medela.
First Cry and Mama Zone.
Yeah. I love Mama Zone. Mama Zone and Medela are together, aren't they? They work together.
Mama Zone are the exclusive distributors for Medela. Do you know, people are funny with breast pumps, but I champion Medela. When I started training to be a midwife, in the hospital it was just all Medela, and then I came here. I mean, a lot more modern now, but they are the best breast pumps.
Worked for me.
I think, and it worked for me as well.
It's not too much of a difference between Medela and how my son feeds.
Yeah, we've got a British Care WhatsApp group in Dubai, and we've just now made a British Care WhatsApp group for Abu Dhabi.
Okay.
And I mean, we give lots of support in Dubai, and we're well known now. But in Abu Dhabi, it's really shocked me how little support there is, and it's like me coming to Dubai all over again from the beginning.
Are you going to stretch out to Abu Dhabi?
Yeah, 100%. Yeah. I have a team going into Abu Dhabi.
Okay.
Yeah, because we can't do Abu Dhabi and Dubai.
Yeah.
Yeah, it's a bit much.
Especially if everyone's calling.
Yeah. We're not pro anything.
Yeah.
You know, if somebody wants a vaginal birth, absolutely we'll try and achieve that.
Yeah.
If somebody wants a C-section, that's fine. So it's all about the woman.
Well, I've got 3 children, and they've all been born a different way. So my first was natural, my second was a C-section under general, and my third was a C-section, but we was away.
Yeah, so I've got 5 children. The youngest is adopted, but I have actually had 5 children. Sadly, I had a miscarriage at 26 weeks and he didn't live, and I had him in Singapore.
Did you?
Yeah. That experience that made me be a midwife, because it was horrendous. They were very cold, not very caring. Oh, it was awful. It was really, really awful, and it really traumatised me. And then it took me 7 years after that to get pregnant again. We struggled. I was desperate for another baby. And then when I got pregnant with Max...
It's funny how when you have a loss, you do
crave,
become almost obsessed with
And people say to you, don't tell them they should have another baby. But I just think, it's what I needed.
Yeah.
I think everybody's individual, but it's definitely what I needed. And it took me 7 years to get pregnant. And then when I did get pregnant with Max, because they did realise that I had an incompetent cervix and I kept having the babies earlier. When I did get pregnant with Max, they put a stitch in. Now, I was in the UK, I wasn't a midwife. The communication was terrible.
In the UK?
Yeah, so they put this stitch in. I didn't realise that you would bleed afterwards. I'm not medical, so why would I think that I would bleed?
Yeah.
So, and I bled really badly. Well, I just thought I'd lost the baby again. So it was an emotional roller coaster. And then I was told categorically I had to have Max by C-section. So I've had normal births and I've had C-section. Do you know what? I got a baby at the end. It don't bother me.
I actually preferred the normal.
Yeah.
There's something about,
it's lovely.
Yeah.
I think my second birth was the best out of all of them. It was a very quick labour.
Oh, really?
Yeah, very quick. And my first one was a bit of a slog, but I had a vaginal birth. My second one was super quick, like 3 pushes she was out.
Oh my goodness.
It was amazing. And then my next one after that, that was super quick, but I had him at 28 weeks. But he's fine, fine. And then obviously Oliver came that little bit earlier where it wasn't.
Yeah, because there's a
Viable.
cut-off point now, ain't there?
Viable at 24 weeks.
And when you've had a loss and then you
Yeah.
have another one, you wait for that,
Yeah, you
that
do,
week
yeah.
and you breathe that
Yeah,
sigh of relief,
yeah,
and, you know.
Yeah. And yeah, because when with Max, they actually, about 24 weeks I was getting hysterical.
Okay.
By 26 weeks they had to scan me every day because I was just thinking I'm going to have a baby here and it's not going to survive. At 30 weeks, and I stayed in hospital upside down.
Oh, you
Yeah,
did the
to
old
keep
leg-
him in, yeah. And then at 30 weeks they let me out of the hospital, and then they said it doesn't matter now when he's born. I'd had steroids, I'd had everything.
Yeah.
And I didn't go into labour until I was 35 weeks.
Nice.
Yeah,
Well
so I
done.
kept him another 5 weeks. And then 2 years later I adopted Henry, and I've had him from birth. I even took drugs so I could breastfeed him.
Oh my goodness, that's amazing.
yeah.
I didn't even know you could do that.
Yeah, you can. Yeah.
Oh my.
Yeah. So I never feel that Henry, you know, is.
So you've got a lot to offer people.
Yeah,
You've got,
well, a lot of experience. I know the practical sides of being pregnant. Some midwives know the theory, but actually they don't know the practical side of it. So I just think it's the whole good package.
yeah, you are very passionate about
Yeah.
it.
I think you have to be because, you know, people deserve the best.
I'd love to be
Yeah.
a midwife, but I don't think I could handle bad situations very well. I'm too emotional.
Do you know, I thought that, especially, you know, what happened to me, I thought it'll bring all that back and will I be able to cope? But actually you can, because you just feel for that woman and you think if you weren't there, you know that you're going to give her the best care, the best support, the best of everything, and you think maybe somebody else wouldn't do it like that, and so that's really important to you then, and it really isn't happening to you, it's happening to them, and not everybody feels the same, so you've got to sort of, you know, you can say, oh, this happened to me, but actually everybody walks a different path.
Absolutely.
With whatever happens in their life, and it's just up to you to guide them down that path, so at the end of it they see the sunshine again, and they see a solution, and that's really, really important.
I had that ectopic. My husband had gone away, and I'd just found out I was pregnant. I'd gone shopping, and I'd seen all these cute little baby things, and I'd started warming up, and then a week later I had a really bad bleed. And then I went to a hospital in Singapore, and they do the whole, you take your blood and then you go back in 2 days.
Yeah.
I was with Thomas, he was 18 months old, and I had to take him. They're very, very good with their healthcare.
Oh,
but
medically, but no emotion.
yeah.
No
And it was-
emotion.
and then they didn't say anything to me. They put me on a bed and just started wheeling me around, but they weren't talking to me, so I was panicking.
Yeah. So I went in because I didn't feel well with Oliver, and I had these terrible pains, and they examined me and my cervix had already started opening. So they said to me, we'll try and sew it back together. Now I know the medical, they shouldn't have ever done that. So they did try and sew it together, and I was in hospital that night, and what happened was I said to the woman, I'm in pain. She went, yes, it's normal. And I said, no, I'm in a lot of pain. She went, yeah, it's normal. And I said, yeah, but I'm really in pain. And then all the sheets went wet. And I said to her, and I'm all wet. And when she pulled the sheets back, I mean, I was just losing blood like you wouldn't
That's
believe.
really dangerous.
Yeah, and she was just ignoring me. And do you know what? In healthcare, you see this a lot where people don't listen to the woman, and the woman knows her body more than anybody. The woman knows herself more than anybody. She knows when something's wrong.
Absolutely.
Always listen to your patient, always, because when they say to you, oh, I didn't feel quite right, you just think you need you need to be here then.
Yeah.
Because women know.
Some hospitals, they quite, even here, you can call me, you can say, look, I think I'm having contractions or something, and you'll say, well, hold off at home for a little bit, and then come in.
Do you know what? It's no good you being at home if you're nervous about anything, because you're just not going to progress, because you're too tense. So I always say to my women, come in, let's check you over, full MOT.
Yeah.
If everything's all right, you want to go back home, go back home.
Yeah.
If you want to stay in hospital, we can make the room all nice, because it's illegal here to have a home birth. Okay?
Is it really?
Yeah.
I didn't know that.
And I think really with the way Dubai is, I think it's a good call. I mean, in England, I did loads of home births. That was my thing. But here, I get it because the roads, what if you have a car accident?
Yeah, I see that.
You know, and the road's blocked. You've called an ambulance. How long's the ambulance going to take?
It does take quite a while to get from A to B
So I
here.
think a home birth, I think absolutely out of the question. I think you're better off in hospital. Hospitals will make the room just like your home if you want them to. You can have it like a home birth.
Yeah.
You don't even have to have a bed in the room. You know, you can do it all nice, but definitely be in hospital.
So if a lady comes and she's under your care, and you know she's happy to go to Gargash, are you able to recommend a doctor who she will see, and will they have that same doctor throughout?
Yes, 100%. Yeah, we work very closely. You know, we're like a proper family.
I've never heard of Gargash until
No,
you
I
guys
haven't.
actually.
I've never heard of it either. And I'll tell you what, the lady that founded Gargash, family are absolutely lovely. And she is IVF
Oh really?
specialist, like the best. And when you go into Gargash Hospital, you see the hospital and everything, but actually, when you go to the back of the hospital, there's a whole hospital that's
I'm glad you
IVF.
mentioned that then, because I didn't know that here nobody talks about IVF.
Yeah, so you can. She gives you the injections to things like, and they process the whole thing in Gargash Hospital, and they store the eggs there as well. So they do the whole thing from start to finish.
I didn't even know
yeah,
that.
and the place is amazing. I went to as I said, oh, can I look into the fertility? Oh, it's,
I want to go look.
yeah.
I want to go look.
Oh
around.
no, we'll come round. I'll
go
show
look
you
round
round.
below. I'll
Yeah,
stay tuned.
and do it on the thing.
Absolutely.
It's unbelievable, and she is fantastic. The amount of people that she facilitates them getting pregnant is unbelievable.
Everybody were telling me that you can't have a baby in Dubai unless you are married.
So that's untrue.
Right. Okay.
So you don't have to be married to have a baby in Dubai. They changed the law about 2 years ago. Okay. You're not insured if you're not married. That's what. So why, I do not know, because there's no reason for the insurance companies to do that. But you are not insured, so you have to cash pay for everything.
Okay.
You will still go to places where they'll say to you, you can't have a baby unless you're married. Loads of people say it, but the reality is it's not a problem. Okay? Even on the DHA website, when you register the baby, there is 2 for married and unmarried. So they've caught up. The insurance people won't pay for the birth or anything if you're not married.
Although it's a lot cheaper here than it is in Singapore.
Yeah, but it is. Me and my husband got married in Singapore.
Did you?
Well, we already did. So we didn't get married in Spain. We lived in Spain for quite a long time. The reason why we didn't get married in Spain, because at the time we weren't Catholic.
Okay.
And they only had Catholic. You could only get married if you were Catholic. So that's why we didn't get married. Then in Singapore, if you weren't married, you couldn't have the baby in Singapore waters.
Okay.
So you had to go on a ship. There was a maternity ship in the waters that you could go and have your baby in, which I didn't fancy that. So we did get married in Singapore. It was a lovely wedding actually, and then our insurance covered it, and we had really good insurance. But yeah, so we didn't actually have to pay for anything, but they were, you know, very adamant that they weren't going to keep Oliver on the life support or anything.
Yeah.
If you're one of these people that, you know, I've never put a thing on my phone saying my working hours are
Yeah.
I just wouldn't do that. I mean, most people know that I'm not about on a Saturday unless I've committed.
Yeah.
But I still answer my phone.
Yeah.
In fact, you know, I think I'm on my phone more than a teenager. I've had to sort of learn all new skills, you know, the Instagram and all that. But
The Instagram.
I find it really weird, you know, that I'm on Instagram. And I'll tell you what's funny as well. If I go anywhere, people
know you.
recognise me, and I think that's hilarious. I never know what to say. They go, "Oh, you're
Is
the
that when-
midwife."
Yeah, my James always wants to come for a cuddle with you.
I'm good with babies, though. I'm good at settling them down.
Yeah.
And I just think that's because when you've had 5, you're quite confident, aren't
I'll
you?
insert a picture here of baby James sleeping
Yeah,
with Julie.
definitely. Yeah,
I'm
yeah,
from Lancashire, you're from Yorkshire.
yeah. War of
So-
the Roses.
War of the Roses, yeah. We've been out of UK for 8 years now.
Yeah.
How long have you been out of UK?
So Spain, I lived 15 years. I lived in Singapore for 2 years, Manila 1 year,
Okay.
Australia 2 years, Bali 1 year, and then we went back to the UK, and Max and Henry were predominantly brought up in the UK.
Yeah.
And then 7 years ago, my husband died. Well, it's nearly 8 years now, and my 3 older children came here one after the other,
Okay.
and then I just
You have a
thought,
daughter too, right?
yeah, I've got 2 daughters, 3 sons.
Okay. I keep seeing your Instagram of, give me a grandbaby.
I know, yeah, no, they're not budging.
You keep asking, give me grandbabies.
Do you know, they go to me every year, what do you want for your birthday? I go, scan picture. What do you want for Christmas? Scan picture. And I go, another birthday without scan picture. But they're all in relationships now, the 3 older ones.
Okay.
So my daughters met a lovely guy. My second daughter, her partner's really, really
She wants
lovely.
babies now.
Yeah. And then Joshua, my son, my eldest son, has met somebody who's absolutely adorable. My friends say to me, especially Liam, she'll say they'll all come at once.
Probably will.
Yeah, no, I'll probably have
Probably,
3, go
yeah.
from 0 to 3.
And
But
then
if I'm at the birth, it'll be as a mother. If there was a
Oh.
problem, I'd be like, right, step away. That's my daughter. And I don't want the responsibility because I think it's a bit too close to home.
Yeah.
Yeah, I would get involved if I had to.
Yeah.
And also, you don't know that they might just want to be with their partner to give birth. You know what I mean? Not everybody wants the mother there, do they? So I'm happy. Whatever they want to do, I'm happy.
I
As
think
long
most
as
of the women
I
want
get
the
to
mothers.
cuddle the baby afterwards.
I think
I'm
most
fine.
of the women want the vet and the
Yeah.
mums there, and the men are a bit like just the 2 of them.
Yeah,
You know what I
yeah.
mean?
So with my first, Charlotte had, I haven't got any parents, but I've got a really dear auntie, and she was at the birth of Charlotte. I said to her, can you be at the birth? I said, because she's got 1 son, and when she gave birth to her son, she said, I don't even remember it. They'd give her that many drugs and stuff. So I said to her, well, just come to my birth.
My dad passed away when I was here actually in Dubai. I
Oh.
was 36 weeks pregnant,
Oh,
and he died the day before my older son's 21st birthday.
oh.
So in the end,
You don't look
I
old
struggled.
enough to have a son of 21.
He's 22 in a
Is
couple.
Oh my
So
word!
yeah, we got. Sorry, Ben.
Don't look old enough, Ben.
Actually, when I had my second, everyone thought Ben was a dad.
Oh yeah,
So I said to him, for your 18th birthday, you get a brother.
yeah.
And then for his 21st, you got another one. I had James, and I was in hospital. I was away from Tom for quite a few days.
Yeah.
And he came in the room. It was like a different child entering. It was like,
Yeah.
them 24 hours,
He'd grown up.
it grown up.
Yeah. And Joshua was 7. We were so worried about Joshua being jealous.
Yeah.
You know, that we were really conscious about and we really did concentrate, me and my husband, about the other children's feelings,
Yeah.
but didn't say to them, you know, a baby only can drink milk. You know what I mean? A baby can only do this. We forgot to do any parenting education with them. And I went for a bath when he was about 3 weeks old. I'd gone for a bath. He was asleep. And Charlotte said, I'll look after him, you know. And I said, oh,
We know
that's
what this is
lovely. And I heard him have a bit of a fuss, but he was, you know, I said to Charlotte, is he all right? Yeah, Mum, it's all under control. And anyway, I got out the bath and everything. I've gone back in to the lounge, and I've looked at Max and I thought, what's all round his face? And I said to Charlotte, what's he got round his face? She said, I gave him one of them Petit Pois yogurts. Because he was fussy. Strawberry yogurt. It's like, oh, right, you know, well, we need to talk about what they can and can't eat. Max was loving life, I've got to say, but yeah, we had a conversation then.
So teeny tiny bit.
3 weeks old, he's had a Petit Pois yogurt.
At least try something that was softer.
Yeah, I did ring up the paediatrician to see if there was going to be any adverse effects.
What did he say?
Oh, no, it's fine. So when I lost Oliver, they told me and my husband we couldn't have any more children. 6.5 years later, we got an appointment in England at an IVF place. And we were going to start IVF in the January.
Okay.
And we had an appointment on my daughter's birthday, which is the 4th of January.
Okay.
And when you went into the clinic, they did a pregnancy test, and I'd been really ill over Christmas.
And you were
I
pregnant?
didn't need IVF.
Oh. So what advice would you give to women having another baby? What would you recommend them do?
I'd do pre-vitamins, because it's really important to have folic acid. And really have quite a healthy lifestyle a couple of months before, if you're planning it.
Yeah.
But a lot of pregnancies aren't planned, and 100% if you've been out and had a good night out or anything like that, and you find out you're pregnant, stop worrying, because these babies are hardy.
That's what I did.
You.
When I found out I was pregnant, the first thing I said to the doctor is, I was drinking, like, not just drinking a glass or two of wine. Like.
So don't get too hung up about that. The baby's quite hardy with certain things, without certain things. Also, don't get too hung up if you're on medication, especially if you're on some medication for depression. People get very worried that that's going to harm the baby. Your mental well-being is priority. You know, you've got to be in a good place. Also, you always do this. I think when you get pregnant, at first you can't believe it, then you get the sickness, so you do believe it. Then the sickness stops and you think, am I still pregnant? I don't feel pregnant anymore. But as a woman, not so much the man, as a woman, you are a worrywart when you're pregnant. Yeah. So you're thinking, how am I going to cope? How am I going to do this? How am I going to do that? How am I going to do this? Will I love my baby? You know, there's all these things that you are 100% going to worry about. You wouldn't be human if you didn't. And what you've got to do is just not worry, because when you see that baby, and it might not be straight away, and that's okay, you might look at your baby and think, what have I done? You know, there might not be this instant love, but it will come. And that baby will bring unbelievable joy to your life. I cannot tell you how much joy that baby, and you will laugh every day, because babies are funny creatures. And as they grow up, they get better. So they start saying words. And when you can see the world through a child's eyes, it's just unbelievable. And when they become, Leanne, the midwife that I work with a lot, she's in charge of all the midwives actually. She's got a little boy who's 2, and he came round to my house yesterday, and I've known him from a baby. So and now he's such a chatterbox, and he knows who I am. He was like, "Can I come again?" I went, "Yeah, of course you can." You're such a cutie, but he's really really talking a lot from not talking at all. And when we got home, because we went to Abu Dhabi yesterday, when we got home, he was telling us he'd been to the pool with Max. He'd
So your
done all
older kids
sorts.
were-
Yeah, we're looking after him, and he'd done all sorts of things. And he had such a tale to tell, and it was just adorable. He was so adorable, and he's been to my house before and not asked if he could come again. But this time he did. But I think that's because Max was there, not because of me. But anyway, he was a really lovely kid.
So if you're planning on having a baby, you say you take your vitamins.
Take your vitamins.
And you
talk
want
to
something
somebody.
You want something with folic acid, right?
Yeah,
Vitamin D.
yeah, you do. And talk to somebody. You know what
Okay.
I mean? Talk to somebody, say, look, we're planning to have a baby, it might not happen. And don't get too hung up if it doesn't happen straight away. Sometimes,
When should they get help? Like if they say if
I
they've been
think
trying
if
for a
you've
while.
been trying for a year,
Okay.
and then you need to come and speak to somebody. Yeah.
You might not need IVF. It might
No,
just be.
no, oh no, there's holistic ways to get pregnant that are very effective.
Like what?
Acupuncture,
Actually, my friend did that when she was trying to get pregnant.
like the miracle thing.
Is it?
Yeah.
Why? What does it do?
So your uterus made of 3 layers,
Okay.
and it relaxes the myometrium, which is the middle layer.
Okay.
So it makes your body more receptive for egg plantation. Yeah.
There you go.
There
See,
we
get
are.
acupuncture.
But you need the right acupuncturist, because some of them don't know what they're doing. So you need somebody that knows what they're doing.
And you can.
And you can use acupuncture for turning a breech baby.
Can you?
Yeah. So there's a lot, but you need the right one. I work with a very good acupuncturist. I absolutely recommend her. And
Is that at Gargash? Or?
no, she's not at Gargash, but I have advised 11 women all over the world that couldn't get pregnant, and there was nothing medically wrong with them, okay? To go for acupuncture. Within 3 months they've been pregnant. It's a 100% success rate.
So if you want a recommendation for acupuncture, get in touch with Julie and she'll be able to give you the details.
Yeah. Even in other countries, I ring people and say, because I know what I'm talking about, I need to know that they know what they're talking about.
Yeah. And you get pregnant. When do they come and see you? So they have the pregnancy test, and then when do they come and see you?
As soon as possible, because I need to make sure you're on the right diet, you're having vitamin C before a meal and things like that. It's good to have a chat anyway in the early, and it's also good to have an early scan, because then you can see that the baby's in the right place.
Yeah. What do you recommend in terms of diet? Like,
Just have a well-balanced diet. Half an hour before a meal, have some natural vitamin C. You'll absorb 10 times more iron from the meal that you're about to eat. And please, when you're pregnant, do not take vitamin A or cod liver oil, which is an omega-3, because it's harmful in pregnancy.
Is it?
When you're pregnant, don't be calorie counting or anything like that. Just have what you fancy.
Yeah.
You know, some people eat a lot of sweet stuff. Don't get hung up on putting on weight.
I think when I was pregnant.
Yeah, I did.
I was
think.
really big. I ate loads. Because I've got no thyroid gland.
Yeah. Did you have it removed then?
I was born without one.
Oh, were you? Do you know that's funny that? Because I was delivering a baby in the UK, and the baby come out, which is very healthy, by the way. The baby came out navy blue, so that's a healthy baby.
Okay. They come out navy blue?
He come out navy blue, right, and he was taking a while to pink up, because they come out blue and then pink up straight away. He was taking a while, and then he went floppy. It was quite hair-raising. I hadn't been qualified long, right, so you can imagine, I was like, oh, you know, I pulled the emergency bell and everything. We had everybody in there, and they took him to NICU. and they did some tests on him. You know, they got him stable and everything, but he did go off.
Okay.
But they got him stable. And they said the reason why that all happened was because he was born without a thyroid. And we'd never heard of it. Even the midwives in the hospital, they've been midwives longer than me. And they named him Max, after my son. I went to all his birthday parties. So I went to his 3rd birthday party. And he was on all kinds of medication. Are you on all kinds of medication?
Thyroxine.
Yeah. So he was on all kinds of medication. When I went to his 3rd birthday party, he wasn't on any medication whatsoever. It had grown.
Oh my goodness.
Yeah, it had
No,
grown.
mine didn't grow.
No, but his did. So because he wasn't born with a thyroid, I mean, there must have been a bit of something there for it to
Yeah.
grow. But because of him, his heart didn't do what it should have done. That's why he stayed blue. So there's a flap in your heart when when a baby takes the first breath, this flap dies. But his didn't, because his whole system wasn't functioning. They had to take him to, and just to tell you this, if this happens to you, so they had to take him to Exeter Hospital, and they literally froze him, right? So they do this thing called cooling, so then it doesn't affect the brain. But they do it in any traumatic birth where they think the baby's been, not all traumatic births, you think the baby's been compromised.
But if you think it's going to affect the brain.
But if you think it's a baby's been compromised and you think it's going to affect the brain, what they do, I'm just going to say this in basic terms, in medical terms it's a bit more complicated, but literally what they do is they cool them so that everything's working, but it can't damage anything. Okay. And then what they do is like thaw them out over 3 days. So it is quite a long process, and it's as if they've been reborn again. And nothing's affected. We only actually use 1/3 of our brain. So there's always 2/3 that ain't doing anything. And if, say, a little bit gets damaged with a newborn, a little bit gets damaged here, then a little bit here can take over that bit. So babies are very hardy, just to say. I know, because I always, when I go around to somebody's house that's had maybe a bit of a problem, the baby's gone to an ICU and things like that, the reason why babies are not doing what they should be doing, not reaching the milestones and things like that, it's nothing to do with the birth or what happened. It's to do with the parents wrapping them in cotton wool.
That's probably
Because you think to yourself, oh no, and we did that with Joshua, and I read a lot about that. I absolutely wrapped him in cotton wool. And when we went to see a health visitor in England, because he wasn't sitting up, he wasn't doing anything, he wasn't talking even, he'd go, ooh, and I'd had 2 chatty girls.
Yeah.
So I was like, oh God, what's up with him? And we just put it down to the fact that he was born 28 weeks, he had a bad start in life and all that. But when I went to this health visitor, she said he can sit up, and she just sat him up in the middle of the room and put a toy between his legs. And then from that day, he talked and everything. I think she frightened him to death. Do you know what the problem with him is? And I went, what? And she went, you. I thought, oh, all right then. I thought, we're a good mum.
When you get that first test, make sure you reach out. Will they come to you, or will they go to hospital for
No,
that?
come to me.
Come to you.
Yeah. Well, I'm in the hospital, so come to me and I'd assign them a doctor at Gargash.
Okay.
They're very lovely. All the doctors at Gargash are lovely.
Okay.
Really, really nice. We have really easygoing doctors. They really know the stuff. They don't push anything. Honestly, listen, it's your body, your experience, your baby. And you make all the decisions. If you were making a decision that was unsafe, we tell you. What you do with that information is up to you, because everything is your choice. And never ever forget that.
I'll link the information below. You can reach out to Julie.
Yeah.
Let us know if you want us to go do a tour, and if you want Julie to come do a milestone check with James.
See you later. Bye.